Welcome to our webinar on advancing student and staff health using COVID relief funds. We are expecting close to 200 folks joining us today. So we know that this is a really important topic, a great conversation. We are excited to have you. If folks want to introduce themselves so we know who is here, please use the chat. Just in terms of how the logistics of this Zoom webinar, we will be using the chat for chat purposes. Also, the Q&A function will be for you all to put your questions and our panelists to be able to respond. And we'll wait just a little bit longer. We'll wait for folks to trickle in. Hello, Trina. Great. Good morning. Good morning. Good afternoon. What time is it? Hi, Allison, Karen, Dusty. Nice to see you all in chat. And also, Stephen, if you could put the policy brief link into the chat. So this webinar is an extension of work that we have been doing. We're really excited to be in partnership with Kaiser Permanente and also the California School-Based Health Alliance and the Partnership for Children and Youth around this topic, around student and staff health and wellness. And in the chat, you'll see a link to the brief that we have written, really going in a little bit deeper. And the goal of this webinar is not to read you the brief, but really to bring the brief alive with the conversations from some panelists. And in terms of what we'll be going over, my name is Hayan Kimner. I am the project director for the Community Schools Learning Exchange and also a senior policy fellow with policy analysis in California education and a collaborator with the Partnership for Children and Youth. What we'll be doing, I'll be providing a brief overview of our federal COVID relief funds, what they are intended to do. But the real benefit of today is listening from the folks on the ground who have been thinking about this, certainly even prior to our state budget, even prior to the relief funds coming in from the federal government to really think about what are the ways that LEAs across the state can be using this this funding source to really think strategically and sustainably about student and staff health and wellness. We have Josh Schultz, who's the Chief Business Official, Deputy Superintendent from the Napa County Office of Education, Mike Lombardo, who's with the Placer County Office of Education, and Lisa Eisenberg with the California School-Based Health Alliance. And once they have talked about some of their work and the work of the LEAs that they are supporting, we'll just open it up for Q&A. Again, invite folks to use the Q&A function in Zoom to add any questions, and panelists can also be responding in real time. For questions that we're not able to get to, please don't think that we're going to lose sight of them. A lot of our work in collaboration with the Partnership for Children and Youth, California School-Based Health Alliance, and Kaiser Permanente is understanding and having a pulse on how folks are thinking about the work and what some of the outstanding questions are. So I'm just going to move forward. Some of you are familiar with Slido.com. One of the things that I have appreciated about working from home and virtual everything is really being able to learn about and play with some of the tools that our instructional folks are doing on the ground in order to engage young people, families, PD, all of those things. So if you all are familiar with Slido, you can go to slido.com, enter in that number, or if you're fancy and you use your phone, you could take a shot of that QR code. And the meeting ID for this is 115872. And we just want to start with knowing who is in the room here. We've got about 80 participants right now, and we want to know where are folks coming from. It is noon on a Monday in the middle of fall. Looks like we have a broad diversity of folks here, and really, really excited to see who's here, because that will also help us make sure that we're speaking to your interests and needs. We got a lot of other in the room. Hi, other. Great to see family and community partners, school administrators. Thank you so much for taking the time in your day to be here. We know that while case counts are going down, vaccinations are going up, there is still a lot of work that folks are doing on the ground. Great. Really curious to know who all of our other are. So let's just dive right in. Esser, most of you all know, there were 3 federal COVID-19 relief packages that came from the feds, Essers 1, 2, and 3, over the course of 2020 and 2021. And those funds will send nearly over $26 billion to California to cover COVID-19 related learning and school reopening expenses. And in terms of what can Esser funds be spent on, it's pretty flexible to a certain extent, right? And so these basics, as listed on this slide, really talk about what are the types of activities. And for the most part, and in the statute and the legislation, lots of activities authorized under ESSA, IDEA, Adult Education Family Literacy Act, Perkins Career and Technical Education Act, McKinney-Vento. So a lot of these being aligned with a lot of these sort of expenditures that are in other federal grant programs. The question is, how do we use nearly $27 billion of funding strategically to plan for sustainable impact? And the challenge here is, how do we think strategically when a lot of folks already are still in the midst of a lot of chaos and a lot of uncertainty? So we hope that why you are here and why we are here is to really talk about this unprecedented infusion of cash. What is that opportunity to create resilient schools that also recognize the critical importance of health and wellness beyond just public health and COVID? So this challenge is one that folks are familiar with. This is one-time flexible funding. So how do we use it in a way that students benefit? But how do we also anticipate a financial cliff when federal and even state funding runs out? And how do we do all that within the spirits and bounds of the federal law? In other words, how are we going to be both strategic but realistic? So one example is, how might an LEA consider the health and wellness priorities for their students and staff? Exacerbated by COVID, but not entirely encapsulated just by COVID impact itself. How do we start to invest and act now? I'd love to see from some of you that are in this room some of the priorities, some of the health and wellness priorities that have risen up for you, maybe because of COVID and maybe even prior to COVID. So if you want to just drop that into the chat, I'd love to take a look at that. One of the things that we also know is that the state fiscal year 21 and 22 budget also reflects this renewed sense of responsibility and momentum for educators to think about teaching and learning environments that respond to the whole child. And this budget, as you well know, is chock full of opportunities. On the one hand, we think, oh, this is really wonderful. We've got all of these funding resources and sources for things that LEAs and communities and advocates have been asking for decades within a largely cash-starved education system. And at the same time, this can be really overwhelming and add to the noise and chaos. And my hope is that it's not. And my hope is that, as we'll hear from our panelists, that we can learn from the work of many other folks across the state and how they are linking, coordinating, aligning, and bringing coherence to these types of activities. So whether we're talking about expanded learning time, social emotional learning and trauma-informed practices, Medi-Cal, family empowerment, MTSS, universal school meals, expanding TK, that these aren't seen as silos, but these are on-ramps to one conversation. So in this brief, we talk about the foundations. How do we go about doing this work? Now, these 5 areas are not things that are particularly innovative or novel. You should know about these ideas, and these really are the foundations. And I want to highlight a couple of things. One is around equitable engagement. So not only is engagement required as part of accessing Esser funding, we also know that engagement is the biggest predictor of success of initiatives and sustainability of initiatives. This is not just about saying who has ideas. What you are doing is you're cultivating champions, rebuilding and gaining trust, and understanding the priorities and resources within your community. Secondly, in terms of identifying those priorities, now we give some references to different data sources that LEAs might be looking to better understand what are the health and wellness priorities within their community, not only for their students, for their staff, for families, but also think about what is that data? What is the story that you are hearing from your community? And how is that reflected in something that might be quantitative versus qualitative? So one of the things around street level data, how is it that you are really looking at and listening to the voices of young people and families? And how does that mirror or at some points be a little bit different from what you might be seeing in terms of your other data sources? The question around mapping your assets and really thinking about that as a foundation. We do needs assessment. Everybody wants to do a needs assessment, but it really is about what are your assets as well. And this isn't just about programs and organizations. What we mean by talking about assets are the people and the relationships, both inside and outside of the building. What does that relational trust look like with your families? And how is that an asset to having these conversations and really prioritizing health and wellness? Our panelists will also talk a lot about spending strategically and planning for sustainability. That is, how do you think about this long-term from the beginning? And how do you choose those interventions and strategies that can grow and evolve along with you? So these foundations are really not just about Esser dollars, but really thinking about how those Esser dollars can be used as investments in the work and the commitments that you are already thinking about. I'm going to pass it to Josh from our Napa County Office of Education, because where you sit, Josh, as a chief business official and working with LEAs and also at the county level, there are some realities that we need to take into consideration. That if we don't take our fiscal realities into place, this is all sort of nice to have, but not very realistic. Josh, love to pass it to you.
Thanks, Han. So hello, everyone. Again, I'm Josh Schultz. I'm with the Napa County Office of Education, Deputy Superintendent CBO. And to start off, I just want to make clear that I have no expertise whatsoever on the best strategies for supporting student and staff health and mental health. But I do spend a lot of time talking with people here in our organization and around the county and the school districts about the things they're thinking about in terms of trying to meet those needs, and have a lot of opportunity to talk with colleagues around the state about how best to use the funding that we're receiving from all these one-time sources. And if you go ahead and go to the next slide, thought it'd be useful just to start by looking at some of the timelines on the major funding sources, many of which were mentioned previously. And part of the point of this is to point out that some of these funds expend many years into the future, and some of them, even the timelines are changing just from week to week. So for example, the Expanded Learning Opportunity Program, which was part of AB 130 in this year's budget, the new expanded learning funding, the trailer bill that just passed, AB 167, actually gave us an extra year to spend the first year of funding. And I think that was in part a recognition that many districts were going to struggle to be able to mount the kind of program that was called for in that legislation when it was only known that they would have the funding weeks before the start of the school year. So there's this tension out here. We're getting it from the legislature, we're hearing it from our communities, you're hearing it just from all the angst around the start of the school year, to hurry up and go out and solve all these needs. But on the other hand, we have some time to figure this out, and I think we need to give ourselves the time to figure it out, or we're going to waste a lot of money. $26 billion was mentioned is coming to California from these Esser programs. That's many thousands of dollars per student. And if we don't spend that money wisely to really meet the needs, now and in the future, we're going to end up wasting a lot of it. Maybe we would have been better off just giving the money to our students, especially our poor students, because we know from all the reporting on the expanded child tax credit, that cutting child poverty is probably one of the best interventions we can do from a policy standpoint. But of course, schools are not in the business of giving out money. There's actually laws against gift of public funds. But we want to make sure that we're being good stewards of these resources. On the other hand, of course, the funds do expire, so we need to be strategic about which ones we use first versus which ones we can save for needs down the line. And just to be clear on a couple of these timelines, the Community Schools Partnership Act, the legislation authorizes those funds to be spent through 2028. Don't actually know when grants are made to individual LEAs, what timeline will be on them, but they're just starting an engagement process that was on a webinar on Friday with the state superintendent, to figure out what the RFA should look like for those. The MTSS funds that were mentioned earlier, I can't see any expiration timeline on those other than that Orange County has to get them out in grants to LEAs. And of course, the one funding source we have that is completely flexible in terms of time is our local control funding formula, the core funding for a school district. That's the funding that can sustain programs for the long term. Of course, we do have a new requirement coming in at the end of this year to track carryover of unfulfilled spending or unfulfilled service improvements from supplemental and concentration. So that's a new policy piece out there that everybody's going to be wrestling with. So if we go to the next slide, please. So again, I think we need to give ourselves time to think strategically about how to use these funds. The fact that we have received new funding, or the fact that we have a requirement to create a new plan, doesn't mean we have to go and spend all this money this year. It doesn't mean that we have to recreate the wheel in developing our plan. So I think most school districts, most LEAs, have been doing a ton of engagement and a ton of planning over the last year and a half. We've had multiple special one-time plans that were required of us. And of course, everybody has just developed new 3-year LCAPs. Many also have strategic plans that either sit nested with the LCAP or are separate. So probably a lot of the needs that are out there you have already identified. So even though legislation may say to you, this funding can be used for X, Y, and Z, I think the first thing you want to do is say, what needs have we already identified, and can we use this funding to meet those needs before we go and try to create new things, before we go to try to add something extra. And even this year, you see, we've got a whole host of new plans that people are required to develop. And I stole this list from a presentation that the Riverside County Office of Education did to their districts. But you could see, you know, that a plethora of new plans. I was calling it a Planapalooza earlier, talking to a friend. But that doesn't mean we should be recreating the wheel if we know where the needs are, right? On the other hand, because everything has been disrupted, right? Because you know, COVID has turned us upside down, forced us to operate in new ways. We have a unique opportunity to really look at, you know, are there things we should stop doing that weren't working before the pandemic, as we kind of recreate, you know, how we're approaching things as we bring our students back into our classrooms. I heard a really interesting interview podcast this morning with a engineer and behavioral economist named Leidy Kotz from University of Virginia, and he's written a book called Subtract. And he's basically saying that humans have a bias to think only to add and not to take away, and thus we often miss the best solutions. You know, so maybe we should be looking at removing barriers to meeting student needs before we look at adding extra services to meet their needs. Up, back one, please. Thank you. So, you know, finally, I just want to say, you know, how to really think strategically about the use of one-time funds. CBOs like to say, you know, one-time funds are not for ongoing costs or for things that eat, because eventually you won't be able to feed those things anymore when you run out of the dollars. And, you know, not only are these funds one time, but of course, many districts around the state are facing declining enrollment, and declining enrollment, it is much worse than they expected at the start of this year. I was on a meeting with a group of CBOs from around Northern California on Friday, and many of them saw extra declines in enrollment at the start of the school year this year, some at the magnitude of 5% of enrollment, more than they were anticipating already from their demographic projections. So we know that funding is going to get tight pretty soon once these one-time funds go away and hold harmless for LCFF goes away. So, you know, you may need to hire new staff. That may be the need, but you need to be clear that this is a temporary position, that we don't have the funds to sustain this necessarily. That needs to be clear to the community, that needs to be clear to your school community, it needs to be clear to the person you hire if that's the case. You know, you can't just say, we're going to hire this person with Esser and pretend that 2 years later when those funds run out, that we're going to be able to sustain it if you don't actually have a concrete plan on how to do that. So, you know, some things that people might consider, for instance, is can you make one-time investments that have a long-term payoff year in meeting student needs? So new training for your staff, perhaps data systems that help you better identify where those needs are on an ongoing basis, perhaps facility investments that allow you to restructure your programs in ways that better meet student needs. Or are there ways that you can use the funds that create long-term savings so that you can then free up flexible funds like LCFF in order to sustain some new programmatic need that's there? Okay. And then finally, I just want to say, if you do decide to do anything new, and I think a lot of us will be doing new things because we recognize that there are areas of student need that we haven't been meeting in the past, that make sure that you start by saying, how are we going to know this is working? When are we going to check that it's working? And, you know, what is our timeline going to be to stop doing this if it's not working? Because I find in school districts, we just add and we add and we add, and we never then are comfortable with taking something away, even if it's not being effective. And that's how we get into resource crunches over and over and over again. So with that, I'll stop and I'll turn it over to Mike.
Okay, thank you so much. Okay, all right. Hello, everybody. Thanks so much for being here. I wish I could see you all in person. My name is Mike Lombardo. I'm with Placer County Office of Education. I want to start off by giving you a little bit of context for Placer County, but first expanding on what Josh was saying. Think about three things during my presentation. One of them is collaboration and braided funding. That's a key strategy to move these ESSER dollar forward. Think about organizational systems, MTSS, PPIS, and then finally, we're going to talk about selecting and monitoring practices. Okay, so here's Placer County. in a nutshell. We're organized in an integrated family and youth-driven process at all levels of our organization. So you saw the foundation elements for Placer. We take these tenets to heart. We have family, youth, our youth serving agencies, all assembled in a policy team on management teams. We have an integrated system of supervisors, and then we have a process for decision-making for high needs families and youth. On our services side, we have integrated teams, wraparound, many programs like wraparound, family, youth, and support teams, and of course, our student attendance and truancy monitoring team. And I just show that to give you all an idea that integration is really a way to capitalize and move forward with how do we think about these one-time dollars that Hyan and Josh were describing to us. So integrated multi-tiered systems of support, again, looking through the lens of integration, but then using these dollars to also think about how do we work with maybe community-based agencies or family-based agencies to nest those or integrate those types of supports onto a school site. So maybe not the answer is hire in more education eaters, as Josh said, or feeders. My CBO says, don't hire any more feeders, people we have to keep feeding. But to really look at what are our partner agencies and what can they provide to schools and districts and families. Okay. I love this slide because it's about collaboration, not collaboration. And we get a lot of collaboration when you see these kinds of dollars on the table. Even internally at an Office of Education or school districts, people tend to look at things in a real siloed way. So as you move forward with Esser, think about in the context of collaboration, that these aren't my department's dollars or our agencies, our district's dollars. These are the community's dollars. They belong to all of us, and we collaborate to spend them wisely. So I want you to also think not just about collaboration, and Josh touched on this a lot. Think about blended or braided funding. So counties and districts get core differentiated assistance dollars. We have all the Esser pool of dollars that Josh described. LEAs are also, if they're not already, able to get Medi-Cal funding. And then of course we have restricted dollars. So think about blending those dollars together instead of siloing them off onto projects, but how can we leverage some ongoing dollars with restricted dollars or things like Medi-Cal that don't pay fully, but can be offset by Esser. And we create stronger outcomes and sustainability. Okay. Now let's really go for it and think about blending more funding streams. So I always joke because my job itself is probably supported by, I don't even know, 8, 9, 10 different funding streams. So really think about creating a strong system by blending things like core and DA, Esser, restricted, Medi-Cal. And then I added here local mental health service act dollars. If you're with a district and you don't know, when I say MHSA or Mental Health Services Act, your homework for tonight is to Google the Mental Health Services Act for your county, and you will see tons and tons of resources for our students and families that they're probably getting that you don't know about. So keep that in mind as you create this rope to strengthen your supports, and of course, philanthropy and grants. Okay, one of my favorite slides. Think about primary prevention first. It costs less and goes further. So as we start to think about the multi-tiered system of support that I'm going to show you in a minute, keep in mind that intensive supports cost a lot more and serve very few children. So don't forget to do primary prevention, things like PBIS or universal social emotional learning, programs like that can get the biggest bang for our buck and often help many, many more students. Okay, so what about the system? It's not complete if I don't show a pyramid or a triangle in a presentation, but I want you to think about how to organize three things: systems, what data are we using to drive our practices? So systems, data, and practices, using a strategy of defining what the problem is or what the need is, analyze why you think it's occurring, implement a solution, and then evaluate. So kind of a plan, do, study, act model. And then organizing your systems around this. And these are not practices I necessarily, I'm saying you have to do. This is just an illustration. If you were to organize the work that we're talking about in Esser, spending those dollars, how do we organize it in a multi-tiered strategy? This is a school example. Schools might be doing individual behavior work, which they certainly are, special education, wraparound, suicide intervention, or a program like Incredible Years, working with direct needs for students. There might be tier 2 supports, things like check-in, check-out, et cetera. You can read all of those. But to look at on this school site or in this district, how are we organized in a multi-tiered way to support students? And then in the community, you can turn the slide. What are the community supports that we have? And this is an area I came to education 12 years ago. And I think as educators, we don't know what community supports are or are available. So previous to coming to education, I was with behavioral health, and I knew there were all these supports in the community supporting students and children and families, but schools didn't necessarily know about them. So as you do your assessment and think about spending Esser dollars, think about what's already happening in the community. And are we duplicating that effort? Or can we fund a community-based agency to do more of it? So something like functional family therapy might be an example. Can we fund a local nonprofit to do more of that rather than hiring the staff ourselves? Okay, go on. And there's two things I want you to think about when you're organizing those practices. One, what practices are we selecting? And then two, do we have an inventory of what we're already doing? But let's look at the selection of practices first. Next slide. So I strongly encourage all of you, as you go about using these dollars, to use a tool called the Hexagon tool. Hyan's going to send out this link later on to all of you, so you'll have the PowerPoint. But the Hexagon tool is an effective way to analyze, do we need this new practice? So everybody's looking at social emotional learning. Do we need randomly selected something like second step? What's the need of second step? How does it fit in our current ecology at the school site or in this district? What are the resources to fund it? One, the training, but two, the ongoing implementation. Is it an evidence-based practice? Are we ready? And do we have capacity to sustain it? So please, 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 as you look at voting with these dollars or using your dollars, take a look at the Hexagon tool from the University of North Carolina Implementation Research Network. Then the next thing we want to do is selection of best practices. So I really encourage districts to do this. And in fact, you can use this as part of your LCAP, giving your board and stakeholders a summary. But do you have an initiative inventory at the district level? What are all the initiatives that we're doing at this district or at this school site? Do we have them written down in one place? Do we know, do we review those initiatives on a yearly or quarterly basis? And this is a tool that will help you do that. You can see if you squint really hard or when you look it up, we want to look at who's leading the initiative, what's the expected outcome, what's the identified population, start, end date, how is it funded, what are the resources to sustain it. So please look at these two tools as you go through and decide how are we going to you spend Esser dollars for students, how are we going to sustain those dollars? Thank you. And I'm going to introduce you to Lisa Eisenberg, who I'm proud to say is a dear friend and colleague of ours.
Good afternoon, everyone. Thank you. My name is Lisa Eisenberg. I'm the policy director with the California School-Based Health Alliance. And we are a statewide organization. If you're not familiar with us, we advocate for improving the health and academic success of children and youth by advancing health services in schools. So that's us in a nutshell. Next slide, Pete, please. And I'm going to talk to you about school-based health centers today. So we at CSHA advocate for all types of health services in school settings, both as a way to increase access to healthcare and reduce health-related barriers to learning. And we think that school-based health centers are one of the best models to do that. And if you are not familiar with a school-based health center, they are essentially community health clinics located in or near a K-12 school campus. They deliver primary medical care, but also deliver integrated behavioral health services. Many have dental chairs and dental offices. Many do vision screenings for students. So they do health education. So they are a really comprehensive healthcare entity located on a school campus. And they can serve students on that campus, but they often serve family members, community members. Maybe they even serve teachers on the school campus and in the school district. So they are a very comprehensive model for delivering health services in a school setting. Next slide. Right now, there are 293 school-based health centers in California, and we continue to see this model grow throughout the state. And we, as an organization, are hoping to see 500 school-based health centers in California by 2030. There's a map on your screen that shows the school-based health centers that we're aware of. They have been concentrated in more urban environments, but we're seeing a lot more growth in the more rural areas in Central Valley and the Inland Empire. All right, so why is this lady talking to us about school-based health centers? This seems like a super specific thing that you all are promoting on this big webinar about how to capitalize on one-time funding, one-time federal COVID relief funding. So there are three reasons, go back one slide. There are three reasons why I wanted to talk about school-based health centers. One, I think that they are an incredibly effective way of building comprehensive health services in school settings that address both health access and educational inequities. So that's number one. Number two, I hope that, as I'm going to talk about, I think of school-based health centers as one example of a way to think about leveraging one-time funding, whether it's the Esser COVID relief dollars, whether it's some of your, maybe it's a community schools grant, maybe it's other one-time funding that you are looking at. I think it is a good example of how to leverage one-time funding and build on short-term investments into long-term investments. And I will illuminate a little bit about that in the next slide. And then the third reason is I think school-based health centers are a good strategy that can become sustainable. So if we're thinking about one-time funding, how can you identify strategies that would benefit from a one-time infusion of funding and that can build on their sustainability? Or maybe they become completely sustainable after one-term funding, or the investment that LEAs have to make in the strategy can decrease. Maybe it's a smaller sustainability funding and it's not a huge one-time investment. So those are the three reasons why we thought it would be helpful to talk about school-based health centers. Next slide, please. So this is an example. There's a really great table in the report that Hayan mentioned that offers you examples of short-term to long-term strategies that you can invest in using one-time Esser funds. And so I've pulled out a couple examples of what we are hearing about opportunities to invest in a school-based health center model, both in a short-term strategy and building on that into a long-term strategy. And I think where you sit really depends on what, if any, infrastructure you currently have, be they actual school-based health centers that are operating in your schools or school districts, or maybe you're currently in conversations with organizations about leveraging them and bringing them in to operate school-based health centers, or you could be brand new to this concept. And so I think where you are and all of those options sort of dictates what strategies, short and long-term, make the most sense. But just walking quickly through this table, I think from short-term, if you have existing school-based health centers, you can leverage them. Or if you have existing partnerships with community-based health providers, you can use one-time funding to work with them to bring those entities onto your school campus to conduct comprehensive health screenings. Lots of young people have not been going to their regular doctor, test for COVID, and address unmet health needs. You can also consider convening a planning group to develop or strengthen school-based wellness strategies, such as a planning committee to think about investing in a school-based health centers. I think in the middle term strategies, some examples that I would pull out is creating a student peer advisory group to assess student health needs and recommend strategies for improving access to school-based health services. Another medium-term strategy is assessing facility options that you might have in your school district for establishing or retrofitting as a designated school health space. And this could be as expensive as a school-based health center. And then longer-term strategies that all build on those shorter or middle-term strategies are to consider developing MOUs and referral protocols with community-based and school-based health providers. Maybe looking into providing startup or facility funding for a school-based health center or school-based health space, and then leveraging community providers to sustain those services through healthcare and Medi-Cal reimbursements. So I hope this is an example of how you can build on short-term strategies along one strategy continuum. It's all around school-based health centers, but building on short-term ones and building them into long-term strategies. Next slide, please. So thinking about next steps and considerations, and I think these actually align really well with the foundations that Hei-Yin launched this webinar in. Doing a preliminary needs assessment, and I think Josh also mentioned this as well. You all have done assessments. You know what your students, hopefully you know what health needs your students are coming into. Hopefully you've had to do these assessments for your LCAPs or thinking about these one-time dollars. So leverage what exists already, leverage who your community partners are already, thinking about what are the healthcare needs of your students. And there are some examples of what those data sources can be on the slide, but also I encourage you to go back to what you have already captured from your students and starting from there. Build a network of champions around school-based health. As Mike mentioned, this is all about collaboration and partnerships. And I think one of the great benefits of leveraging school-based health centers is bringing in community partners that can take on some of the work of keeping your students healthy and prepared to be in class and learning. And then the last consideration I would throw out there is, especially with one-time funding, is thinking about creating, I like to call, a runway to sustainability. I think that there are very few, if any, community-based partners or even school district employed staff that you hire them or you bring them onto your school campus and they are automatically sustainable. Like there takes time and systems to create sustainability. So I do encourage folks to think about one-time funding to allow those providers, to allow those partners to establish referral systems, to establish relationships so that after a 2 or 3 year long runway, they can be more sustainable at the end of that period of time. And they can generate revenue to cover cover all or at least a huge majority of their services. And I think that is it for me, and I'm going to pass it back to Hagen.
All right. Thanks, Lisa. We're going to do some Q&A. I know that folks have not yet put in questions in the Zoom tab. I invite you to do so in the bottom right-hand corner of your screen, but I have a bunch. So we can start with my questions. I would love to hear from Mike and Josh about real specifics. You both are very close to the decision-making, the daily decision-making of LEAs that you have been working with. Can you give some specific expenditure examples or investment examples with regards to either addressing needs and or building capacities and systems to be able to do this longer runway that Lisa talked about?
Mike, you want to start?
Sure. I'm thinking of a specific example. I have a good example. It wasn't necessarily Esser dollars, but it was an opportunity to use some one-time dollars to affect and impact mental health in Placer County. We launched a system called Handle with Care just this last week in Placer. And it's an opportunity for first responders, child welfare, law enforcement, fire, hospitals to scan a card that looks like this. Well, that